Good morning and welcome to the Tuesday edition of The Point. Today is June 18th, the 169th day of 2019. There are 196 days left in the year. I'm Bruce Morris.
And I'm Steve Schaefer. Coming up on today's show, we will be speaking with 3 Central Oregon men about the HIV virus and specifically about preventing new cases of HIV and even ending new cases of HIV altogether. They will share how all of us can take personal responsibility and personal steps to reach that amazing and once almost inconceivable goal.
Inconceivable goal. That's a typo. We are here today. We're going to be talking about, as we mentioned at the beginning, about HIV, that human immunodeficiency virus, and that it exists. It's not something that's in the headlines as much as it was at one point many years ago, but it's what we want to talk about is something that I think, having grown up, come of age in the 80s, and having seen the origin of HIV when they didn't even know that's what it was, and the AIDS epidemic, something that was really, to me, and a lot of people, I think, really frightening. And now seeing there is a goal that's not completely far-fetched of actually trying to end all new cases, new HIV cases. And so we have 3 gentlemen. We're very fortunate and really grateful for all 3 of you coming in. Richard, Jamie, and Dylan, Central Oregon gentlemen, coming in here to talk about HIV prevention, tell their stories and talk about what they're doing and what the rest of us can do. And so we'll just get started. Richard is here. We're going to start with Jamie. Jamie is, again, a man who lives in Central Oregon. And can you tell us, Jamie, a little bit about your story? Tell us whatever you want, but, at some point with HIV and how that worked. I'm awkward asking these questions. I always am, it seems like. I just want to be really open about that. So, yeah, I guess you can tell us your story.
Absolutely, Bruce. Thank you very much for having us on this important topic, and thanks again to KPOV. As Bruce said, I live here in Central Oregon, and I was diagnosed with HIV 11 years ago. I was in my mid-40s at the time, really in the prime of my life. I was extremely physically active, running multiple marathons, long-distance cyclist, and even racing an Ironman triathlon. I practiced safe sex, and by that I mean I always had sex with condoms. I tried the best I could to have a sense of who my partners were, to understand what the risk might be at that level. But unfortunately, as I mentioned 11 years ago, I was diagnosed. I was actually diagnosed really soon after infection. I had started not feeling well, like a severe case of the flu that lasted more than 10 days, and in the back of my head I thought there's no way it could be HIV because I practice safe sex. But went to see my physician, and through multiple rounds of testing, a positive diagnosis. I was seroconverting, which means that I was developing antibodies to the HIV virus in my body. So I'll be honest, it rocked my world. Much like you said, Bruce, I was in college in the early 80s and witnessing the devastation that HIV and AIDS had, primarily on the gay community. And as I'm getting my diagnosis from my physician, I'm looking at a chart she had on the wall that was really based on data from the 1980s, before active antiretroviral drugs or good treatments were available. And typically, 50% of the people who became diagnosed with HIV would develop AIDS and die within 10 years. And that was devastating to me, because my biggest concern was, how is this going to affect the longevity of my life? Because I was living my perfect life at the time. But I had a very progressive physician. At the time, again, 11 years ago, this was in 2008, physicians were still 50-50 on when to start treatments. I'll back up a bit. Really good treatments, which go by the acronym HAART, highly active antiretroviral therapies, became available in 1996. There were typically 3 or 4 drugs, separate pills that you would take daily, a few times a day. Since then, and definitely at the time that I was diagnosed, treatments improved even more. And right now, and even back then, it's literally 1 pill a day that you take. You take it with your breakfast or whatever routine, and that's it. But in 2008, as I said, when I was diagnosed, there was a 50-50 divide. Some clinicians said start treatment straight away. That way you preserve an individual's immune system, as well as reduce the risk of transmission to others. But other physicians were saying, well, let's wait until your T cells reach a level of 350 or below. So when you have HIV, there are two very important numbers that become part of your daily vernacular, if you will. One is your T cell count, and T cells are a type of immune cell, a very important type of immune cell, a specific type of T cell called a CD4 positive cell. And this is the cell that HIV attacks most rigorously. And when your T cells, an average person has a normal T cell level of about 500 to 1500 T cells per microliter of blood. With HIV infection over time, that number will fall. And when the number falls below 200, that's when an AIDS diagnosis comes into effect.
So can I just to simplify it for my own understanding, and I think maybe some of our listeners, basically what HIV does is it attacks and destroys certain immune cells, including the T cells, and that's how it effectively that's how it makes people sick.
That's correct.
Okay.
Your immune system gets destroyed by HIV. HIV attacks a number of other different cells, dendritic cells, macrophages, which are also part of your immune system. But the T cells are really one of the most important cells in your body for your immunity. They play a role in attacking cancers before they become cancerous, infections, opportunistic infections, basically everything. They're your frontline warriors.
Right. So then it leaves you vulnerable to all of these kinds of infections that your body would otherwise most likely be able to fight off.
Absolutely.
Okay.
Absolutely. So T cells count is one number that you hear of often, and the other number is viral load, and that's the number of viral particles, HIV virus particles in your blood per volume, per microliter. And when you become initially infected with HIV, that viral load is going to be greater than 1 million copies of virus per mil in your blood. And then that will slowly, without medication, decrease just because your body will recover to some degree. And then, unfortunately, without treatment over time, viral load goes up again and your T cells start to fall again. With treatment, however, it's different. Your HIV viral load will go down, and what they call undetectable is what's desirable. And an undetectable viral load means that you have less than 50 copies of virus per volume of blood. And if you are undetectable and you've been on treatment for greater than 6 months and you've been undetectable for 6 months, you cannot transmit the virus, which means you cannot pass the virus on. It's 100% effective if you're in treatment with HIV. And so that's why it's important for everybody to know what their status is. If you are positive, you need to get into treatment to preserve your own immune system, but also from a public health policy, if you are being treated, you cannot pass the virus on to your sexual partners.
Okay. Right. Once you get to that level of undetectable, and you said it's 6 months consecutive, right? At the undetectable level.
That's correct.
Okay.
That's correct.
And so, right. So you're right that there's a dual reason to seek treatment, right? Your own health and then public health. So, Should we move on, Richard? And we can just kind of adjust that mic a little bit. We have our usual small studio here at KPOV and 3 people. So anyway, Richard, thank you very much for joining us.
Yeah, thank you for having me, Bruce. So similar to Jamie, I was tested about 10 years ago. I'm 22 years old. I was just getting out of college, living with my grandparents in Colorado, and I was regularly tested, like every 2 to 3 months I would go in and get a test. I didn't have a background of knowing exactly what the epidemic was like at my age, but I knew it was important to go take control of your sexual health and your health in general, and did that. So luckily when I was tested positive, it was within that window. And so when I tested positive, as Jamie said, initially your viral load is in the millions. And so that was where I was at, with my the only fear that I had, similar to different from what Jamie said, knowing that people would die of AIDS, and also you would maybe only live 10 to 15 to 20 years. I went in and my doctor said that, you're going to live a full, normal, healthy life. And so by the time I went in, it was standard of care. Even a year after when Jamie went in, and they wouldn't give you the meds immediately until your T cells went to the 300 level. They were prescribing it immediately and getting you into care. So since then, 10 years ago, I am undetectable and living a normal life. My biggest fear was not the disease. It was actually how I would pay for that medication. So I was just out of school. I did have health insurance through my parents. And when I became positive, I actually got kicked off the health insurance. So, that's another topic for another day, but luckily there was a program called Ryan White. And it's a national HIV AIDS program that's funded every year bipartisan through Congress. And basically what it does is it gives you access to HIV care, and it also pays your medication if you're a low-income person. So it's really about getting tested, getting into care, and regardless of your socioeconomic status, you can get the resources that are needed to get you to that undetectable level, so that you are taking care of public health as well as your own health.
So this is the Ryan White program.
Mm-hmm.
Okay, and that's available to anyone who has a positive HIV status. Is that correct?
So anyone who has a HIV positive status has access to the Ryan White funds. There is it's for low income people, but also OHP in Oregon has similar programs to help at other income levels and other resources for healthcare. So being in Oregon, you do have a lot of access to programs to pay for, and also healthcare resources, which you can find out on Deschutes.org/HIV testing. There's tons of resources available for payment.
Okay, great. All right. Thank you very much, Richard. And we're going to get to Dylan. We have to take a quick break. Just a super fast break, couple quick messages from KPOV, and we'll get right back. We want to hear Dylan's story. And again, thanks very much, guys. All right, we're back on the Tuesday Point. And we're speaking with 3 Central Oregon men about HIV and HIV prevention, with the goal of ending all new HIV cases. And we're joined now by Dylan. Dylan, thanks very much for coming in.
Thanks, Bruce. Good to be here.
We need to get you a little closer to the mic.
Okay.
Sorry, yeah, kind of. So, Dylan, again, thank you for joining us. And you're here. You are a person who you're not HIV
negative.
HIV negative. Mm-hmm. Okay, and so can you talk about what are the steps you take, or you can tell us your story a little bit if you want, but I also don't understand what steps you take towards prevention yourself.
Okay. Well, I'm HIV negative, and my toolbox of prevention is to take Truvada in concurrence with condoms. And Truvada, which also goes by the name PrEP, is a medicine that prevents HIV infection in those who are negative. And when used correctly, it is over 99% effective with condoms. And when I first started using PrEP, it was early 2016, and I hadn't heard about it from my doctor or from any major publication, but rather a friend. And so I went to my doctor and I asked about Truvada. And my doctor, who I trust very much, was not familiar with Truvada and actually asked me if it was scientific, if it had a basis in science. And, I realized that medical school for him was a long time ago, but the important point is that I think taking your own medical history and your own medical well-being into your own hands is important, and educating your doctor, who might not be up to par with the most recent information, is key to that. I first started taking Truvada. It was, it helped me to be free of anxiety that goes with having relations with others because of that strong stigma that came from the 80s that, HIV is a death sentence, and it's no longer a death sentence. We have, strong funding in researching this topic, and PrEP helps you prevent HIV by, inhibiting a scientific process within the cell. Excuse me. But I think what I really want to talk about is that Truvada is for everyone. PrEP is for everyone. It's not just for men or transgender people that identify as gay. It's also for straight people. It's also for drug users. It's for everyone, and it's important in our toolbox to prevent HIV.
All right. So, and we talked about this yesterday. You said it's important for more than just people who are LGBTQ. Can you talk a little bit more about that? What other kinds of people, or what other ways are there of I guess, acquiring HIV?
Well, you can acquire HIV through transmission of blood. You can acquire it if you're an intravenous drug user. But you can also acquire it through, heterosexual sex. As long as you know your partner, I think there's, some level of safety, but you don't always know your partner, and sometimes you don't always use protection, and there's a risk to everyone. It's not just a disease or virus that affects a certain community. It affects everyone. And it's a bipartisan issue, and if everyone can start taking the control into their own hands, we can eliminate HIV entirely.
All right. Yeah, I wanted to be really clear about HIV is not something that's specific to any particular community. It's right. A virus. It's out there. It transmits like any other virus, and
yes.
And it can So I don't want to be alarmist, but it is that there were cases in the mid '80s of people hemophiliac people. With clotting factor that was infected by HIV, so it's one of those things. Can we put this puzzle together? We've talked about a few different pieces, how this all adds up to no new cases.
Sure. So the first step for everyone is everyone has a status, and everyone should know their status, which means everybody should get tested at least once in their lifetime. And
go ahead. I just wanted to throw in that if you were listening a few weeks ago, I actually got tested on the air. It was completely done from the time the show began, before the show even ended. It was really simple. It was a tiny little finger stick, so it's really easy to get tested. Go ahead.
Yeah, that's great, and that was a fantastic show, and it is easy, and there's HIV testing that's confidential and freely available here in Deschutes County through the Deschutes County Health Services. But know your status. If you're negative, that's great. Good for you. If you turn out to be positive, then get into treatment straight away so that you can maintain your immune system, get your viral load to be undetectable, where then, as I said earlier, you cannot transmit. If you are at risk for HIV infection, through whatever means, as Dylan said, there is PrEP, which is a pill that's taken once a day, and you're monitored every 3 months by your physician when you're on PrEP about what's going on with every aspect of your health, basically. And that reduces your infection ability to be infected by 92%. And as Dylan said, if you combine that with condom use, it's 99% effective. It's really about taking care of one's health. And as it's definitely not a gay man's disease or a gay man's risk by any means. Here in Deschutes County, women are testing positive this year. And these are women that have most likely acquired HIV either through injection drug use, but also by having sex with their partners. So no one is immune to this. And as I said, everyone should find out what their status is.
All right. So there will be testing available this weekend. Would you like to talk a little bit about that coming up?
Yeah, so through the month, Deschutes County will be testing at various locations. You can find out all locations on their website at deschutes.org/HIV testing. This week is Pride Week, so we have a few testing locations available. One is at Crater Lake Spirits from 6 to 9 on Thursday, downtown Bend. They'll have the testing van out in the back parking lot, alleyway. For anyone who wants to get tested, it's free HIV testing. In addition, we will be in Drake Park on Saturday, June 22nd, from 11 a.m. to 6 p.m. For the LGBTQ Central Oregon Pride. And that both of those opportunities are good opportunities to get tested. But again, go to the website at Deschutes.org/HIV testing, and there's locations throughout the Tri-County area to get tested. So.
All right, great. Thank you, Jamie, Richard, and Dylan. I really appreciate you joining us, talking about this very important issue. Is there any one more thing anybody wants to throw in before we close out? Nope. All right, great. Thanks again. Yes. All right, so that's going to wrap it up for our show today. We again really appreciate Jamie, Richard, and Dylan for joining us. You can listen to The Point every Monday morning at 9 a.m. For the people, events, and organizations that make Central Oregon unique.
You can also listen to KPOV live streaming 24/7 at kpov.org.
And our theme song for The Point, as always, is Zigaboogaloo by Nicholas Payton.